Okay. So last time we were talking about total body fluid, and some students did not understand it completely. Also, a small portion of that topic was left. So we are going to cover that now. It will not take a long time. Maybe we can finish in 15 minutes. Okay. If you all pay attention, we can finish it in 15 minutes. Otherwise, it will take slightly longer time. Okay. Now we are going to start once again from dehydration and overhydration. Okay. So just a second. Yes. So we are talking about disturbances of the body fluids, which means if in the body there is more water or less water. More water, we call it overhydration. Less water, we call it dehydration. But we have already discussed that there are different compartments in the body. Okay. So for example, inside the cell, we call it intracellular fluid. Outside the cell, we call it extracellular fluid. Yes. So the water inside the cell, intracellular. Water which is outside the cell, extracellular. And when do we say that the body has too much water? When extracellular fluid has too much water, we will say body has too much water. When extracellular fluid has less water, we will say that the body has less water. Okay. So that is the first thing which you have to remember, that which we will look at first. We will look at extracellular fluid. Okay. In between, I will keep translating in Hindi and Urdu as well. तो ईसीएफ देखेंगे हम सबसे पहले, ठीक है ना। ईसीएफ भी होता है और आईसीएफ भी होता है, ये सबको पता है। सेल के अंदर जो वाटर है उसको आईसीएफ बोलते हैं। सेल के बाहर जो है, जितना भी सेल के बाहर है, उसको एक्स्ट्रा सेलुलर बोलते हैं। तो हम जब ये कह रहे हैं कि बॉडी में पानी कम है या पानी ज्यादा है, तो हम क्या देखेंगे, ईसीएफ देखेंगे या आईसीएफ देखेंगे? हम ईसीएफ देखेंगे, ठीक है। ईसीएफ के बेसिस पे हम डिसाइड करेंगे कि पानी कम है या ज्यादा है। और अगर ईसीएफ में पानी कम होगा तो अकॉर्डिंगली आईसीएफ एडजस्ट करेगा। Okay, so if ECF is having less water or more water, ICF will also adjust, but that will happen afterwards. That is the second part that we will not see first. First, we will see ECF. Okay. What is the other students are unable to join the lecture? See, how can I help if other students are not able to join, my dear? Again, I can repeat the same thing that if 2, 3 students have joined from the same room, please use one phone or one laptop. Okay. Don't use 5 different phones. Okay. So that you can give chance to other students as well. Please. These are your classmates, your group mates, right? You have to help them. Okay. Anyway. All right. So this much we understood. Now dehydration, which means less water. Less water where? In the ECF. कहाँ पे less water की बात हो रही है? ECF में dehydration की बात हो रही है. This is of 3 types. First type is isotonic. Okay. Isotonic means, see, I will try to use a whiteboard and I will try to write it. Okay. So that you can understand. But right now, isotonic means both water and sodium are lost. Okay. So first of all, dehydration means water is lost. Yes. Isotonic dehydration means water is also lost, sodium is also lost. What are the examples? Gastrointestinal fluid loss, which means diarrhea, burns, hemorrhage. In all these cases, water will also be lost from the body and sodium will also be lost from the body. So it is isotonic. Okay. Next, hypertonic dehydration. Hypertonic dehydration means salt, which is sodium, is not lost, only water is lost. So this will become hypertonic. Now, what is becoming hypertonic? What is becoming isotonic? The ECF. Okay. We are talking about the comparison of ECF and ICF. Okay. So if both have the same amount of sodium, then they will be called isotonic. Okay. But if sodium is lost from this, then this will become hypertonic. Okay. You have to understand that when we say hypertonic, we are talking about ECF. ECF became hypertonic. Why? Because from ECF, only water was lost. Only water was lost. Now there is a lot of sodium. So this became hypertonic and this became hypotonic. Okay. So this whole concept of isotonic, hypertonic, hypotonic, this is in comparison with each other. Okay. And we are doing comparison of ECF and ICF. Right. So what are the examples in which only water is lost, sodium is not lost? The examples are diabetes mellitus, diabetes insipidus, alcoholism, lithium salts intake. In this, what will happen? The person will lose water by urination. Only water will be lost. Sodium will not be lost. Okay. And the last case is hypotonic. Hypotonic means from the ECF, water is lost. Obviously, water is lost. Why? Because we are saying it is dehydration. Dehydration means water is lost, but sodium loss is larger than water loss. Okay. So a lot of sodium is lost and water is also lost. So this will be called hypotonic dehydration. And the only example of this is primary hypoaldosteronism. This is the name of the disease. So when I ask you in the module, what is the disease in which there is hypotonic dehydration? The answer will be primary hypoaldosteronism. This is the name of the disease. And the main job of aldosterone is sodium retention. So what is this disease? In this disease, a hormone named aldosterone is reduced. Okay. Hormone named aldosterone is reduced. That's why hypoaldosteronism. If aldosterone is reduced, the function of aldosterone is to absorb sodium from the kidneys. Okay. And I have told you sodium and water, they love each other. Okay. So if sodium is coming back into the body, water will also come back into the body. But if sodium is not coming back, water will also not come back. So sodium is also going from the body, water is also going from the body, but sodium is going in large quantity. So this will be hypotonic dehydration. Okay. And the name of the disease will be primary hypoaldosteronism. Now we are going to see the types of overhydration. Overhydration is also having the same three types, but the causes are different. The reasons are different. Okay. Dehydration means the water in ECF is reducing. Overhydration means the water in ECF is increasing. Okay. So when water in the ECF will increase, there are three reasons. First reason is isotonic. Okay. So isotonic NaCl oral or IV. What does this mean? Why? See, some students did not understand. What we are saying, the person is taking water, okay, which is mixed with NaCl. So NaCl mixed with water, you either take it orally or you take it intravenously, which means in the vein. So both these ways, if you take a lot of water, which is mixed with NaCl, then the ECF quantity will increase and it will be overhydration. Okay. So isotonic overhydration. Why isotonic? Because the concentration of this water, because of the NaCl, is same as the concentration of blood. Okay. So if both the concentrations are same, it will be isotonic. What about hypertonic? So the same water which was mixed with sodium chloride, if this concentration is higher, okay, if this concentration is more than the ECF, then it will be hypertonic. Okay, it will be hypertonic overhydration. And the last thing is hypotonic overhydration, which means you will take water mixed with less salt. No. Hypotonic overhydration occurs in case of a disease which is called SIADH, syndrome of inappropriate ADH secretion, which means there is a hormone in the body which is known as ADH, anti-diuretic hormone. Diuresis means to urinate. Okay, to urinate. Anti-diuresis means it will stop the urination. How it will stop the urination? It conserves the water by absorbing sodium. Okay. So ADH is a hormone. It is present in all of you. Okay. What this ADH hormone does, it absorbs sodium in the kidneys. So I told you already, sodium and water, they have a love story. Yes. So if sodium is absorbed in the kidneys, the water will also be absorbed, right? So if water will be absorbed, then urination will be reduced. So that is how ADH works, antidiuretic hormone. That is how it works. But what will happen if the body is producing too much ADH? Too much ADH is being produced. So water is not being lost in the urine, right? And if water is not being lost in the urine, then there will be overhydration of the body. The ECF amount will increase. Okay. So that is the syndrome of inappropriate ADH secretion. And it can happen because of stress, mental, emotional stress, or surgery, and any such conditions, okay, where the body is under stress. This syndrome can happen. Now, what the body does, if you're having this syndrome, the body will not just sit like this and relax, okay? The body will produce another hormone, another substance to fight this. How that will happen? See, there is excessive ADH, okay? Excessive ADH, which means the kidneys are absorbing too much sodium. Too much sodium is being absorbed, right? Now the atrium of the heart will detect this extra sodium, okay? So the atrium of the heart, when it detects this extra sodium, it will produce ANP, okay? This ANP is atrial natriuretic peptide. Atrial because it is coming from the atrium, natriuretic because it is causing, natri means sodium and uretic means urine, right? So this ANP will cause the sodium to leave from the urine, okay? Which means it will cause exit of the sodium from the body. And as we know, water loves sodium. So when sodium leaves the body, water will also leave the body. Okay. So this ANP is actually working against the excessive ADH. Okay. So first SiADH happened, then the body produced ANP. And because of ANP, the sodium was removed from the body. And when sodium is removed from the body, water will also be removed from the body. Okay. So diuresis means urine, production of urine. All right. Natriuresis means when sodium is lost from the urine, that is natriuresis. Okay. So these are the examples of dehydration and overhydration. Now we have to discuss some graphs, a little mathematical. Okay. So I'm going to try to show you from my phone. I will try to draw and show you these diagrams that we're talking about, okay? Because in the lecture hall, I was using the whiteboard. So here also, I should try to use the whiteboard because it will be easy to understand. All right. Yes. Okay. Please tell me in the chat, can you see the screen? Can you see the white screen? Yes. Okay, tell me what is written on the white screen. Okay, great. You know maths also. Very nice. Okay, guys. So now you look at the white screen, okay? I will stop this sharing. You can look at the white screen. Let me see if I can rotate this. Why it's not rotating? Okay, anyway, even if it's not rotating, you can see. Huh. So guys, what we have to do, we have to make a graph, okay? We have to make a graph. In the graph, we have to show, see, this is ECF, this is ICF, okay? And this is 300 milliosmoles per liter. Don't worry, I will explain what we are talking about. See, you all know that the quantity of ECF is just a second. How do I use the eraser on this? Give me just a moment. Okay. So the quantity of ECF is lesser than ICF. Yes, we all know that. Now we are just making a diagram. See, this quantity is ECF and this quantity is ICF. Okay, just remember this much. And this is the concentration of ICF and ECF. So 300 milliosmoles per liter is the normal concentration of ICF and ECF. Okay, which means in your body, in my body right now, if you check the concentration, then it will be 300 milliosmoles per liter. What is the meaning of concentration? It means how much sodium is present. Okay, how much sodium or how many solutes are present in our ICF and ECF. Okay, now we will take the cases one by one. So what happens in case of our, first I will tell you what happens in the case of dehydration. Okay, dehydration. So the first thing we need to know in dehydration, that the quantity of ECF will reduce. Yes, dehydration means quantity of ECF will reduce. But I am talking about which dehydration? Isotonic, hypotonic, or hypertonic. That is also important. So first, let's talk about isotonic dehydration. Okay, isotonic dehydration. So dehydration means, see, originally ECF, the size was how much? Originally, this is the size. Yes, this much. But when there is dehydration, the size of ECF will reduce. So now ECF is only this much. Okay, ECF is only this much. And we will draw it till here. Why? Because it is isotonic. Isotonic means the concentration is not changing. So the concentration will still be 300. Okay, the concentration is still 300. Now, if the concentration of ECF did not change, then ICF will not change. Okay, see, the flow of water between ICF and ECF, it will only happen if the concentrations are different. Okay, so if there is more sodium in ECF, then water will go to ECF. If there is more sodium in ICF, water will go to ICF. But if both are having same sodium, then water will not cross in between these two. Okay, so in this case, water will not cross between ECF and ICF. So how much will be ICF? It will be the same. ICF will remain unchanged. So this will be the ICF. This will be the ICF. Okay. So this is the case of isotonic dehydration. Isotonic dehydration. Okay. Did you understand? Please send me message in the chat, yes or no. What we are trying to show is that in the diagram, how the values are changing. Okay. So those who are saying no, now I will explain overhydration. Okay. Then you will understand. So this was isotonic dehydration. Now just below this, I am going to draw isotonic overhydration. Okay. So see, first you draw empty diagram. This is the empty diagram. Yes, this is normal ECF, ICF, and the concentration is how much? 300 milliosmoles per liter. This is normal concentration. Okay. Now, last time we said isotonic dehydration. This time we are going to draw overhydration. So how we will draw overhydration? See, this was normal ECF. Yes, this was normal amount of ECF. But now we are saying ECF has increased because overhydration. Yes. So ECF will increase. Okay. So we will draw the diagram like this. Okay. Because ECF has increased. So it is more than normal. Yes. But again, what did I tell you? The water will now see what you might think that, okay, now ECF is having more water. Yes. ICF is having same water like before. So some water should move there. Yes. No, water will not move there because it is isotonic. Okay. And I told you that water will only move from high concentration, from low concentration to high concentration. Yes. Low concentration sodium to high concentration sodium, water will move. Here, because it is isotonic, water will not move anywhere. So how much will be the ICF? The ICF will remain same. Okay. So in case of isotonic dehydration, and here up it is dehydration and down it is overhydration. So why are we saying dehydration? Because you see this space, this empty space, this ECF is reduced. So it is dehydration. And what about this over here? This ECF has increased. Okay. So it is overhydration. So that's the difference between isotonic dehydration and overhydration. Now, how many understood and how many didn't understand? Again, please send yes or no in the chat, because we have two more cases. We have hypotonic and we have hypertonic. Okay, mostly I'm saying yes. Thank God. Otherwise, I would start hitting my head with something. Okay, so now we are going to see, let's say hypotonic. Okay, let's start with hypotonic. So first we have to see hypotonic dehydration. Okay, dehydration. So first thing that you have to do, see, I can ask you to draw this diagram. I can say, what is the name of the student? I can say Shahyar Haider, or I can say Uttam Saini. Draw this diagram. Show me hypotonic dehydration. So what you will do, first you will see this. First you will see, okay, dehydration. It means ECF is getting reduced. ECF is getting reduced. So new ECF will be only this much. Only this much. Yes. Only this much. Next, you have to see it is hypotonic, isotonic, hypertonic. If it is hypotonic, so this was normal concentration. Yes, 300 milliosmoles. If it is hypotonic, then it will end over here. Okay, it will end over here. This will be your new ECF. Okay, it is hypotonic. And what about the ICF? What about the ICF? See, ICF will also be at the same concentration. Why it will be at the same concentration? Because ECF and ICF, they are friends. Okay. So if ECF is having low concentration, ICF will also come down to same level. If ECF is having high concentration, ICF will also come to same level. They want to be at the same level. Okay. So this is dehydration, hypotonic. Now again, what is hypotonic? What is hypotonic? The ECF is hypotonic. Okay. This ECF is hypotonic. So then someone has to be hypertonic, right? If ECF is hypotonic, ICF has to be hypertonic. So this is hypertonic. Now please tell me in the chat, if one liquid is hypotonic and other liquid is hypertonic, the water will move in which direction? From hypo to hyper or hyper to hypo? Please write in the chat in which direction the water will move. Hypo to hyper. Very good. I am very happy that so many of you have answered correctly. No, it will not move from hyper to hypo. It will move from hypo to hyper, because hypo means less sodium. Hyper means more sodium. Okay. So water will move in direction of more sodium. Okay. So in this case, when water will move from ECF to ICF, the ICF will increase. Okay. The ICF will increase like this. Understood? So although ECF is itself is reduced because of dehydration, but because it is hypotonic, the water will go from ECF to ICF because ICF became hypertonic. So water will move in that direction. Now, next case, we will talk about hypertonic dehydration. Hypertonic dehydration. First, you draw the empty diagram. Yes. This is ECF. This is ICF. This is concentration. How much is the concentration? 300 milliosmoles. Okay, now when I ask you to draw, what are you going to see? First thing I told you, first you will see this word D. Sorry, this is overhydration. Na? We are doing overhydration now. This is overhydration. Yes. So first word that you will see, overhydration. Okay. Which means ECF is having more water. So easily you can draw more water, which means first ECF was this much, but now it has increased to this much. Okay. This much. Next, you will see the second word, which is hypertonic. Hypertonic, which means it will go above this level. Okay, it will go above this level. So it will reach like this. This will be your ECF. This will be your ECF. Now, see, now ECF is hypertonic and ICF is hypotonic. So now don't tell me hypo to hyper or hyper to hypo. Tell me water will move from ICF to ECF or ECF to ICF. Tell me this. Tell me the answer. Now ECF is hypertonic. Yes, ECF is hypertonic. So water will move from ICF to ECF and it will be like this. It will be like this. Again, why this concentration level is same? See, let me point out why this concentration level is same. Because ECF and ICF are friends. They want to come at the same concentration level. And because of that, this ICF will lose the water. So ICF water is reduced, ECF water is increased. Okay. So this is hypotonic dehydration, hypertonic overhydration. And we have two more cases, hypotonic overhydration and hypertonic dehydration. Okay. So, okay, let's do one thing. I will stop this sharing now and we will come back to our slides. Okay. Now when you look at these images, right? First look at this one. Okay, let me reduce the number of images. So many images together, we start to get scared. Yes, even I get scared sometimes. So now when we are looking at this, isotonic dehydration. Okay, so the first one is isotonic dehydration. You see, dehydration means water is lost from the ECF. But is there any effect on ICF? No. Why? Because it is isotonic. So water will not move here and there. If ECF is losing water, only ECF will lose water. Okay. In second case, isotonic overhydration. Here what is happening? There is more water in the ECF. But any effect on ICF? No. No effect on ICF because it is isotonic. So no movement of water will take place between ECF and ICF. Now let's see the second case. Second case is hypertonic. Hypertonic. You see, this is the normal line. This black line is the normal line. Okay. In the above figure also, in the bottom figure also, black is the normal line. And where is the concentration going? It is going above, hyper. Now this is hypertonic dehydration. Hypertonic dehydration. So this, you can see, it's above normal concentration and ECF is lost. Okay, ECF is lost. This is hypertonic dehydration. What happened in this case? ECF is reduced and it became hypertonic. So ICF also got reduced. Yes, ECF was reduced. Why? Because dehydration. But it is hypertonic. So water moved from ICF to ECF. And when water moved from ICF to ECF, ICF also reduced. Okay. So it will give this kind of graph. Then hypertonic overhydration. This is hypertonic overhydration. What happened here? See, hypertonic, the concentration is above normal. Yes. And overhydration means ECF is having more water, but it is hypertonic. So even if ECF is having more water, still ICF will give more. Why? Because ECF is hypertonic. Okay. So whoever is hypertonic, they will get the water. Okay. So ICF is giving more water to ECF. Although ECF is having already overhydration, ICF will give more water to ECF. So you will get this type of diagram. And the last one is hypotonic. So hypotonic dehydration and hypotonic overhydration. Here what is happening? See, dehydration, which means ECF reduced. Yes. But ECF is hypotonic. So who is hypertonic? ICF is hypertonic. So what happens? Water will move from ECF to ICF. That's why you see ECF is increased. Urdu explains, sir. I cannot repeat again and again in Urdu. Okay, first I will finish this class, then I will start new meeting. I will explain in Urdu because it will take double time. You understand? 1 hour lecture will become 2 hours if I'm repeating in English also and in Urdu also. Okay. The last thing is hypotonic overhydration. See, if you don't understand so well in English, maybe after the lecture, immediately after the lecture, ask your friends, what did sir say? Can you explain to me in Urdu? Okay. Last case, hypotonic overhydration. Hypotonic overhydration. You see, the concentration is below normal. Yes. This dotted blue line is below normal concentration, but it is overhydration. So ECF is overhydrated, but ECF is hypotonic. So water will go from hypotonic to hypertonic. Water will go from ECF to ICF. So that's why ICF is also increased. Okay, ICF is also increased. Now, I hope you understood these diagrams. You have the PDF, look at them again and again, try to understand. Okay. And the last thing is, I wanted to share this question with you. Okay, let's do one thing. I'm going to end the meeting now and I will start a new meeting and you should join again. Okay. Because we are only having 2 minutes and we have to meet Mr. Jobless. He has a question for us. Okay. So I'm ending the meeting. Please join again immediately.